Today, we will gradually lift the curtain to reveal and focus on garlic. If you have any of the health issues we will discuss here, we strongly advise you to avoid eating garlic. This is another episode about a food that, despite its obvious benefits, may not be healthy for you due to your unique health conditions. In fact, it may even make some health issues worse. Garlic is well known for its various health benefits. It can help control and lower blood pressure, prevent cardiovascular disease, heart issues, and stroke by forming blood clots, and stabilize blood sugar, particularly in diabetics. Garlic is a powerful antioxidant, antifungal, antibacterial, and its list of benefits is endless. However, there are some distinct side effects and dangers that we will discuss today. We will also happily offer some solutions at the end of the video and also discuss the proper suggested dosage in certain cases. So who should avoid garlic? Well, that may sound strange to you, but some people should avoid garlic, especially supplements with higher concentrations. First off, some patients with gastroesophageal reflux disease, GERD, may refer to it as reflux. Because garlic is now so widely used, those who experience pain or aggravation of symptoms after ingesting garlic may need to avoid it or consume it in moderate amounts. Garlic has the potential to aggravate symptoms of GERD in certain people, such as heartburn and acid reflux. Garlic's effects on GERD symptoms may also depend on how it is consumed. Compared to cooked or processed garlic, raw, powdered, and supplemented, garlic may be more prone to cause GERD symptoms. Garlic's strength and ability to worsen acid reflux may be lessened by cooking. Each person has a different threshold for garlic, and some people may discover that they may eat tiny amounts of garlic without feeling negatively affected by their GERD symptoms. Individuals taking blood thinners in second place, the blood-thinning properties of garlic can interfere with the effectiveness of blood-thinning medications like warfarin, aspirin, or other anticoagulants. Eating garlic in conjunction with these medications can increase the risk of bleeding or bruising easily. If you are taking blood-thinning medications and you notice that you are bruising easily, you should limit or remove your intake of garlic for a calculated period of time to monitor any changes. If you enjoyed the video so far, you could think about subscribing to the channel in order to support this modest content provider and watch more videos just like this one. The third group of those experiencing stomach problems, garlic's high fructose content can cause bloating, gas, and diarrhea, especially if consumed on an empty stomach. One easy way to avoid this is to eat garlic with your meals, or perhaps after an appetizer. I'd say this is the second most common reason people avoid taking garlic. Fourth, those who have specific medical conditions should refrain from taking supplements containing garlic first thing in the morning. People with certain medical issues, such as hypoglycemia or low blood pressure, those with low blood sugar should use caution when eating garlic. Garlic may lower blood pressure because it has been shown to have hypotensive effects. The hypotensive action of garlic can be advantageous for those with hypertension or high blood pressure, whereas components such as allicin, which can help relax blood vessels and promote vasodilation, are thought to be responsible for this impact. It could be dangerous for people who already have low blood pressure, especially if taken in high quantities or in concentrated forms like supplements containing garlic, which can cause lightheadedness and even fainting. Garlic consumption should be avoided by those who have hypoglycemia, since it might lower blood sugar levels even further and cause symptoms including weakness, confusion, sweating, trembling, or fainting. Patients with specific autoimmune disorders ranked 5, we are starting to notice how much more prevalent autoimmune illnesses are in modern society. Although garlic is not one of the foods highest in oxalate, it still adds to the dietary oxalate intake, especially when consumed in large amounts or in concentrated forms like garlic supplements. Oxalates are known to bind with calcium in the body to form calcium oxalate, and major component of kidney stones. 8th, nursing mothers. Did you know that garlic can occasionally alter the flavor of breast milk? This can cause fussiness or refusal to feed in some babies, but Moderate consumption of garlic is generally considered safe during breastfeeding. People with a history of kidney stones, especially those who are prone to calcium oxalate stones, may need to moderate their consumption of high oxalate foods like garlic to reduce the risk of stone formation. For the time being, you should avoid giving your infant garlic if you see that they are not drinking milk. Let's discuss the recommended daily dosage of garlic. I'd want to share with everyone something very essential that I discovered when testing with garlic and garlic supplements. Garlic supplements aren't nearly as effective and healthy as fresh garlic. So if you don't fit into any of the above categories and want to take advantage of all the amazing health benefits of garlic, here's what you need to do. First, never eat garlic on an empty stomach, and don't take more than the recommended daily dosage of 1 to 2 cloves. Remember that when garlic is cooked, many of its healthy qualities and substances, such as antioxidants and allicin, are lost. I understand that it might be challenging to estimate how much garlic you will eat when you are cooking, so generally aim for 1 to 2 cloves per person. In conclusion, while garlic is renowned for its numerous health benefits, it may not be suitable for everyone, especially those with certain health conditions. If you suffer from any of the conditions mentioned, such as acid reflux, irritable bowel syndrome, or bleeding disorders, it's best to avoid consuming garlic or to consult with your healthcare provider before doing so. Remember, everyone's body reacts differently to foods and supplements. So what works for one person may not work for another. It's critical to pay attention to your body and put your health first above all else. If you found this information helpful, don't forget to like this video and share it with your friends and family who may benefit from it. For those with bleeding disorders or those taking blood-thinning medications, garlic's anticoagulant properties can pose risks of increased bleeding. Garlic can interfere with blood clotting, which may lead to complications for those with clotting disorders or individuals undergoing surgery. And if you haven't already, subscribe to our channel, Health Angel Solutions, for more informative content on how to improve your health and well-being naturally. It's imperative to be aware of your body and prioritize your health above all else.